remember going and looking in the mirror and being so amazed how I went from point A to point B. I used to be able to fit a straw through about 4 different spaces between my teeth, and now I had a perfect smile that I could be proud of. But that was the main part. But the one other thing that really made me want to go into dentistry was my actual orthodontist reaction. I was looking into the mirror at my smile, and I saw his face out of the back of the mirror, and he was smiling twice as big as I was. And I realized how rewarding of a profession this is, and I really think it's something that I could do just because I really want to help people on a day-to-day basis.
Great. Thanks so much, TJ.
Thank you.
Josh, how are you?
I'm pretty good. How are you?
Could you please share with the audience when you first knew dentistry was the right career for you?
I kind of had a very similar experience to TJ. My mom's in the military, and back when I was probably in middle school, she was in the office getting a routine procedure done. And being my young self, I was very curious, and I had an accidental question about something about the cavity, about the preparation. I can say cavity and preparation now because I'm in my first year. But essentially, he kind of just brought me over his shoulder and walked me through what he was doing. And it was very exciting to me, very interesting. And so throughout, from middle school to undergrad, I kind of nourished that interest. I started to shadow with dentists, and each experience I had just kind of confirmed what I really felt, which is that dentistry is an amazing and unique opportunity to help people in need in a way that's unlike any other healthcare profession. So,
thanks so much, Jocelyn. And Dr. Esther, a very warm welcome to you.
Okay, it's good to be here.
Dr. Esther, given your previous experience in recruitment and admissions, talk to us about some of the qualities you look for in a potential applicant.
Thank you so much. Applicants who are enthusiastic, who enjoy people, who have a desire and a capacity to serve the underserved or those who are in need fit our profession very well. You need to have some hand skills. Dentistry does require the use of your hands, and so those who find manual dexterity is a benefit for them. Sometimes that is manifested through art or fine art. People who may do things like weaving, basket weaving, sewing, crocheting, playing any fine-tuned sports, playing the piano, for example. Many skill sets that you wouldn't even think about that may be useful, that demonstrate your manual dexterity, are very useful tools in the practice of dentistry. As Jocelyn could attest now that she's a first-year dental student, the ability to hold a handpiece and to produce a form preparation on a tooth is a very fine skill, and so that is very important. So you cannot start too early to develop your hand skills. In addition to that, those who are like independence or enjoy working for themselves, kind of setting their own hours, being very organized, and enjoy setting their own schedule, dentistry has a wonderful place for you. Many dentists find themselves balancing their career with family and other activities, whether it be civic activities, community-related activities. We find ourselves in a plethora of experiences that really add to our career, but finding that balance between profession, community, family, and other interests is really the hallmark of many dentists, and you will find us in varying places around the community. For example, one of my classmates from dental school actually was a professional model for years, as well as a practicing dentist. And so that's just an example of how we find ourselves in various skill sets. So I like to encourage students in a very early stage to think about the love and compassion they have for science, the ability to master math, science, biology, that inquisitive nature to question and seek out answers, and again, a love for people are hallmarks of a wonderful potential dental student.
Dr. Esther, thank you so much. TJ, we know you were involved with Xhosa, so tell us a little bit about how your experience with Xhosa has been helpful now as a college freshman, and how you hope it will be helpful in your journey to becoming a dentist.
Okay, so Xhosa is a health-based student organization. I did it all throughout high school, and I first got into Xhosa when I was a sophomore. My dental teacher told me to go into it for a dental science competition. It was awesome. It allowed me to go to national conferences and compete and meet people from all over the country, and it really allowed me to start working hard and at something that I love. So I got to kind of compete against all these kids who were just as interested in the healthcare profession as I was, but it pushed me to work that much harder to do well. So I ended up placing in the top 10 for all 3 years, and it really kind of makes me feel that my hard work is paying off, and that's kind of what I brought into college. Putting in all of this hard work is worth something in the end.
Great. Thank you so much, TJ. Jocelyn, how about you? When you were in high school, what specific activities helped prepare you for being a successful dental student?
In high school, I participated in a lot of extracurricular activities. I played basketball, I ran track, and I was a part of a couple of student organizations at my high school. And I think that's very important when you're looking forward from high school to undergrad to dental school. These experiences are going to teach you how to work well with others, which is going to be invaluable in dental school as well as in the dental profession, as well as it's going to teach you about time management, which is going to be a very key part of being a dental student. Why, if you have an assignment and you feel like you can do it in 6 hours, try to get that down to 5 hours, try to get that down to 4 hours. And so being well-rounded and being involved in extracurricular activities is going to help train you in managing your time as well as working well with other people.
Great. Very good insight, Jocelyn. Dr. Esther, in your opinion, what are 2 or 3 examples of what high school students should be doing right now to prepare for dental school and ultimately a career in dentistry?
One of the first, I think, most profound opportunities that a high school student can do right now is to seek out their neighborhood dentist, their family dentist, and attempt to shadow, spend some time in the office. Besides being the patient in the chair, you'd be surprised how many dentists would love and welcome you in to their practice just to shadow, just to observe. In some cases, that may turn into an opportunity to come back for multiple visits and shadow, but also sometimes even job opportunities. So I would strongly encourage high school students to make sure that their dentist, their family dentist, knows that they have an interest in the profession. Secondly, if you have an interest in research, a summer research program, any type of opportunity that kind of furthers your knowledge base in the health professions, I would strongly encourage that. Particularly if you can do volunteer work at a hospital or community center. If you get a chance to see healthcare delivery taking place, whether it be dentistry, medicine, veterinary medicine, nursing, you name it, find opportunities to see service taking place. Those opportunities will inform you in a way that will just further your career in ways you would never understand. Again, because our profession is a service profession, and we see ourselves many times as servant leaders in our capacities, but also as educators, health educators, and important oral health educators. The ability to interact with people and educate them on the critical nature of their oral health is important. So the opportunities to see that as a high school student can never be underscored. Lastly, or third, I would say, do really well in math and science. You're going to need it. You're going to need it tremendously. And find ways to enjoy the science or the love of science. Many high school students who have an interest in dentistry enjoy the natural sciences, whether it be biology or chemistry or physiology or an anatomy course. But the ability to master sciences, to start to understand the sciences on a deeper level, to again develop that intellectual questioning and curiosity, it can't start too early, but it will follow you throughout your career path. And so, again, I would strongly suggest to enjoy your sciences and get as much experience in the sciences as you possibly can.
Absolutely.
Great. Dr. Esther, some very, very solid examples for everyone in the audience today. TJ, as a recent high school graduate, give us 3 examples that a high school student can do, 3 things a high school student can do right now to help them prepare for a future dental career.
Okay, so first of all, definitely challenge yourself academically. I think a lot of the times throughout high school, a lot of kids just try to get the easy A so that they have straight A's, perfect grades, and they can get into a good college. But when you get into college, the courses are a lot harder, and if you're taking easy classes all throughout high school, you're not really going to be prepared for those classes. So definitely take those harder classes because you'll be kicking yourself later on if you don't. Number two, I'd say take good notes and learn how you study. For me, I'm still trying to figure out how I study. Throughout high school, it was one way, and I like to sit on the couch and kind of be by myself in a room quietly. And when you're in college, a lot of the times you're in the dorm, there's lots of people always all around you. So kind of find your own area to study, figure out how you study, and do that the way to the best of your ability. And when it comes to dentistry in particular, I think shadowing is the best way to get into the dental field and kind of see how everything works in high school. I found that was the best for me. I loved going to my dentist and just seeing him do even the most basic procedures because it just made me realize like everything that he does on a daily basis, and I could see myself doing that on a daily basis.
Great, TJ, thank you so much. Jocelyn, now that you are in dental school, what do you wish you knew in high school that would have helped you on your path to becoming a dentist?
I wish I would have known a little bit more regarding the admissions process into dental school, just specifically the DAT. I wish I would have known a little bit more about how to appropriately prep for that, because I feel like the SAT is an amazing opportunity to practice good test preparation habits for the DAT and eventually your boards. I will just say this to all the high school students: do not kind of play off the SAT. It's important for getting into a good undergrad school, but it's also really important for just practicing the habit of taking really big admissions tests. Trust me, it's not going to be understated. You will pat yourself on the back if you do well in the SAT, because it'll set you up directly to do well in the DAT. So just a little bit more about the admissions process as far as interviews, testing, and that kind of thing. If you can start looking into that now, it's kind of getting an idea of what to expect. I feel like that will definitely benefit you going forward.
Great. Thanks so much, Jocelyn. Dr. Esther, as students start preparing to apply to dental school, they will hear a lot about being a well-rounded applicant. Describe what that means to our audience and share with us a couple of activities that can help students move in that direction.
That's an excellent question. We consider an admissions process for dental schools a whole applicant, and we consider the process to be called a holistic review of your application variables that are useful or necessary for admissions into dental school. Those two areas broadly are known as the cognitive variables and the non-cognitive variables. The cognitive variables being your GPA and your DAT score, which Jocelyn just aptly stated that she wished she had more information about that in high school. And so those two components comprise the cognitive portion of your application. But the non-cognitive portion of your application is really well within your grasp. So those are things like your leadership skills, your volunteerism. As TJ spoke very, very firmly about shadowing opportunities. If you have an interest in research, if you have an interest, if you play the piano, if you ride motorcycles across country, if you run across country or have any athletic abilities, if you played high school or college sports, if you had an interest in leadership and was a leader of a student organization, if you had a very strong interest in volunteerism and have done mission trips across the world or across your own city or across your state, I can go on and on, but the point is the non-cognitive areas are areas that you control. Is really about your interests, your particular self, what makes you unique. The hallmark of the non-cognitive portion of your application are letters of recommendation, and we require those from professors who have taught you science courses. So having relationships with your science professors, TJ, are really important in college, making sure you visit office hours and have conversations with your professors so that they get a sense of knowing who you are. And so when you come to them again later at the time of the application for dental school process, you can ask those same professors of biology and chemistry to write you a strong letter of recommendation. The personal essay that you write for dental school is also a very strong component of the non-cognitive area of your application, and it also gives you a chance as the applicant to really express who you are, to share with the admissions committee in any way that you feel is appropriate the hallmarks of your process for preparing for dental school. And so I highlight those two areas broadly because it's never too early, as TJ and Jocelyn both stated, to think about these things And there's so much you can do about that right now in your process. Some strategies that I would say are very useful, I've already mentioned one, is have a strong relationship again with your college professors, particularly those who teach you math, science, and any of the biologies or chemistry areas. Those will be required for admissions to dental school, and we look at those letters quite strongly. Secondly, if you have an interest again in volunteerism or service activities, if you have an interest in research, I would encourage you to be involved as a college student. Those areas really play well in the fact that you can do, as Jocelyn stated earlier, you have good time management. It will be necessary for the rigors what you will find in the dental education, dental school time of your process. And so again, you can't start too early to think about these things. In high school, I would strongly suggest you can start right now in leadership and student organization. Start right now communicating with your teachers, letting them know, does your school counselors, do they know that you have an interest in the health professions, and particularly in dentistry? They should know that. And many of you I applaud because you probably have district counselors know, and that's probably why you're on this webinar today. But I applaud you continue along that path. And the last thing I would say is to seek out opportunities. There's several programs across the nation that will invite you to the dental school campus to see dentistry. There's various open house opportunities. There's various hands-on opportunities and various research program opportunities. So I would encourage our high school students to think about all of those things, but in particular, think about what is your own interest. What are you passionate about? Life is too short to not do things that gives you joy at the end of the day. And so I would strongly encourage our high school students to define for yourself what you enjoy, and make sure you incorporate that into your educational process. I don't think it's been stated yet, but I must state right now, you do not have to major in a science major to go to dental school. And I'll say that again, you do not have to major in biology, chemistry, physics, math to go into dentistry. About a third of our class, for example, Elizabeth, have not majored in the science areas. But of course, they will need to get the requirements for dental school. So I just want to share that so that our students get an understanding that being well balanced, that process started in high school and now will play out in your application process, and the admissions committee look highly favorably upon a well-balanced applicant.
Thank you so much, Dr. Esther. And my final question before I open up the floor to the audience members is this, and this is a question for all three of you. If there was one critical piece of advice you could offer today's attendees about what they can do right now to prepare for a future career in dentistry, what would that be? TJ, I'll start with you.
My piece of advice can be fairly cliche, but don't give up. It seems like the road to dental school is full of bumps and rocks, and I think my road is full of cobblestone. Like, it's just so many bumps after bumps after bumps. But don't give up. Make sure that you know where you want to be in the end, and one day, hopefully, you'll be able to call yourself a doctor, and other people will be able to call you their doctor.
Wonderful advice, TJ. Thanks. How about you, Jocelyn?
One critical piece of advice is just explore your interests. I will say I originally thought I wanted to be a dentist back in middle school, but that was reconsidered many times between now and then. And that's okay. You guys are young. You're in high school. It's okay for you to reconsider your options, but definitely explore the things you are interested in, including dentistry, so that once you're on your path and you start on your path, you have that certainty to drive you through. There are going to be times that are very challenging, times that you may consider quitting, but you won't because you know this is exactly where you want to be. So that's one of the best things you could do for yourself, either in dentistry or your careers worldwide. So definitely do that.
Thanks so much, Jocelyn. And last but certainly not least, any final piece of advice, Dr. Esther?
Well, they took both of my top choices, but I will say definitely just know that we need you. Our profession needs bright, young, educated, compassionate individuals, men, women, of all walks, of all creeds, of all colors, of all religions, of all sexual orientations, of every possible diverse area. We need you in our profession to serve humankind. There's not enough dentists right now to serve our United States population. Over half of our population go without dental care and dental insurance in the United States of America. So we have a tremendous job to do, but But I would end just like this, and I usually say this when I talk to students and do recruitment, but it just says, no vision and you perish, no dream and you are lost. Your heart must ever cherish some faith at any cost, some hope, some dream to cling to, some rainbow in the sky, some melody to sing to, some service that is high. And for me, dentistry is about service, and I applaud all of you for thinking about this profession.
Very, very nice last words, Dr. Esther. Thank you so much. Well, thank you, all three of you, for your honesty and your candor. We really appreciate it. So now I'm going to open the floor up to some questions. We definitely had some questions come in ahead of time and some questions during the webinar. Some very good questions I see. So this is a question that I think all three of you could answer, but maybe I'll start with you, TJ. So one of the questions is, how should I go about asking a dentist to observe them or, to shadow them? You briefly mentioned that, TJ, in answering one of your questions. So I know that you're pretty inspired by who you shadowed. So if you could tell us a little bit about what you did to ask the dentist that you shadowed, what was your process?
Well, it's really important to go throughout all different specialties and shadow as many as you can. The way I started was just going to my personal dentist, my general dentist, and kind of just during an appointment asking him, telling him how I was interested in the profession. And right after that, he told me that I can come in within the next week or so. But the other times I went into shadow, I basically just called him or walked into the office since it was fairly close to where I lived. But giving a call is definitely a good idea. Receptionists could always kind of find a time for you to come in and make sure that the message is relayed to the dentist.
Great, thanks so much. Jocelyn, do you have any thoughts on, how to approach a dentist about shadowing?
Yes, I actually have a unique story to share as well. When I was in my early undergraduate years, I was in a very rural town, and I decided I needed to get some more shadowing hours. And there were only 6 general dentists in the whole town, so I was very limited to my options. But I just printed out a list on Google Maps. I went to the very first dental office and just flat out told me no. He didn't want anyone in the office, which is well within his right to say. Went to the next one on the list. Same thing. He said no. Nobody to shadow in my office. I finally go to my 3rd dental office. I just walk in, of course, clean up nice, put on some nice clothes, but I just walk in. I go to his receptionist. His receptionist grabs him, and he's like, well, do you have a CV? And I didn't have a clue what a CV was. So you high school students out there, look up what a CV is and go ahead and prepare one. But the moral of that story is just knock on all the doors. Some people are going to tell you no, and that's okay. But if you keep knocking on those doors, you're going to find someone who's going to bring you to their office and who's going to be very valuable to you. Dr. Marshall was the dentist who did that to me. First of all, he taught me what a CV was, which was great because you really need to know that. And secondly, he mentored me all the way up until my point of starting here at VCU. He got me into summer programs. He helped me shadow in his office. I interned with him during the summers. Just a truly invaluable experience. So worst comes to worst, just go knock on all the doors. Some people are going to say no, but keep knocking until you get that yes.
That's a great story, Jocelyn. Thanks so much. And how about you, Dr. Esther?
Yeah, thank you. Thanks for sharing that, Jocelyn. That's very real. The reality that someone may say no the first time, and in all of our paths, as TJ stated, we're going to have some bumps, some lumps. We're going to have some cobblestones. We're going to have some no's. And being able to persevere beyond that, Jocelyn, I applaud you. But I think that is going to be something I think our high schools should hear loudly and clearly, that you're going to have some no's, and your ability to persevere past those will be important. I would also offer to speak to your own dentist, your own hygienist, as you go in for your routine cleanings. As you all should know, you should do that twice a year, and your parents will probably take you twice a year. Make sure you talk to them, engage them at that moment. That's a very good opportunity to say, I was on a webinar with the American Dental Education Association learning about the profession of dentistry. I have an interest in the profession. What would you offer as far as some tips that I should be thinking about as a high school student that wants to go into dentistry? You'll be surprised at the response you will get. I won't try to capture the response. It'll be variable, but I'm sure you'll get a very warm response to that and a very good pat on the shoulder. My first dentist that I shadowed, my parents, I want to state clearly, my parents did not graduate college, and they are not dentists. And so for me, being a first-generation college graduate, it was really important to find mentors. And so my first mentor was from my church. His name is Dr. George Taylor, but he was my mentor that was a member of my church, and he happened to be a public health dentist, but also a faculty member at the University of Detroit Mercy, where I grew up in Detroit, Michigan. And so he was so warm and so receptive to have me come in, created a week-long program for me in his own office, at his school, at his practice. It just showed me and exposed me to the profession. He is still my mentor and friend today. And so these relationships that you will establish right now with dentists, they don't go away. And just to give some clarity to what Jocelyn mentioned earlier about a CV, that's a curriculum of vitae. It's much like a business resume, and so many of you may be more familiar with that term, resume. But in the science areas, a curriculum vitae, and I encourage just, as Jocelyn said, to go online, Google that, and learn about the components of it. But in the science areas, it captures your experiences. It captures all of the work opportunities you've had, education opportunities, as well as research opportunities, any scientific papers and things of that sort. And so I just wanted to clarify that just a little bit more for you. But definitely, I think in Jocelyn's message and TJ's, be prepared when you ask them, because they're gonna encourage you. They're gonna sometimes challenge you. You may get a few no's from him or her, male or female dentist. But just know that you will find the right fit for yourself, and that coming into the profession to shadow will change your life tremendously.
Great. Thank you so much, all three of you. Another question that came in earlier today, and I think it's a very fascinating question, and I think all three of you will have very different responses to this question. How can parents help students navigate the path to becoming a dental student and then consequently a dentist? Jocelyn, why don't we start with you?
For me, my mom was very involved. Much like Dr. Esther, I was a first-generational graduate student, and so I didn't know any dentists personally. And so the best thing that my mother did for me was just become extremely involved. She did her research. There are points in this process where she probably knew more about it than I did. And I think that's something that parents who are looking to help their children matriculate into dental school and into the dental profession can do that. Just do your research online. I always say Google it. You'll be able to find some pretty good information just as far as the process, what to expect through undergrad, trying to get into dental school, and the dental school curriculum. So just do as much research as you can, speak to as many people as you can who've been through it, and just you'll pick up little pieces of knowledge from different people, and it'll help you to kind of get an idea of what to expect and how to better prepare yourself.
Great, Jocelyn. Thanks so much. How about you, TJ?
My parents were very supportive and have always told me to kind of follow my dreams. So throughout undergrad, or throughout high school and going into undergrad, they pushed me to do my best in school, always got on top of me with everything, making sure all my homework was done. But, you know, when you go to college, they're not there to be on top of you. So little by little, they kind of tried to push me away and kind of tell me to do my work and let me do it on my own and see what happens. So it's definitely important to have that space and also get that help from them when you need it. So these last couple weeks of college, it's been helpful to have my parents kind of on the phone every couple, like almost hours, but it's not every couple hours, but it seems more than I expected. So definitely having that support system comes a long way in the end.
Great, thanks so much. And how about you, Dr. Esther?
Wow, you give me a chance to talk about my mom and my dad. Thank you. My parents were my biggest supporters. I stated they did not graduate college, but they were the most educated people that I will ever know. They were my first mentors. They gave me unconditional love. And so I knew that when I got the no's from society or from professors or from whatever the challenges were of the day in my path to my career, I knew that I had a stable home base in my mom and dad that wouldn't falter, wouldn't change, and wouldn't leave me. I think that's the most profound gift that a parent can give a child, unconditional love. And so I would encourage parents to just do that. Just be the supporter, be the cheerleader, be the disciplinarian when necessary. Sometimes as a high school student, we probably feel our parents are more disciplinarian than anything else. but it's for a purpose. And so as I navigated college and undergraduate years, as I navigated dental school and the 13-year process that it was for me to get to my specialty, my parents was always, they're not understanding the length of the process that I was getting myself involved in along my educational path. But they were there to just support me and to love me. And so I would just encourage parents to do just that.
That's great. Thanks so much. So Dr. Esther, there's a specific question for you. So everyone else can hold their horses for just a second. It's about the infamous financial aid. A student was asking any tips about financial aid, and specifically, how long did it take you to pay off your dental school loans?
Well, that's a great question. Let me start like this. Don't let the loan indebtedness or the cost of education deter your goal for becoming whatever your path will be. In this case, we're talking about dentistry, of course, but you may, as Jocelyn stated earlier, you may change along the path and know that that's okay. If you decide by the end of high school or by the beginning of college that your path is going to be a little different than dentistry. But just whatever you choose, don't let the financial cost be the barrier that prevents you from getting there. For me personally, I did take out loans for undergraduate years. I went to Morehouse College in Atlanta, Georgia. And I did take out loans to go to dental school. It was a different time, though, and so loan indebtedness when I graduated dental school in 1994 was around $100,000 for students. And I think students now hear that number and feel like, wow, I wish I could come out with that amount. At the time I went through dental school, I would share with you, and I think it's important to understand that it was just as daunting to me and my colleagues at that time to think about $100,000 in debt to go to school. That was very daunting for us. But again, I did not let that stop me, and I would just encourage students at whatever level on the path to not allow that to be the case. I think you should be very creative around how you, not only what you take out for loans, but also how you will pay them back. For example, there's different types of loans. Some have a higher interest rate, some have a lower interest rate. I would encourage you to look into those opportunities. If you have an interest in serving in the military or serving in the public health service or serving in the underserved areas, you'll be amazed to understand there's a lot of programs available that will pay for your dental school years, and if they don't pay for the school years as you're accruing the loans, they will pay you back in what they call loan indebtedness. They will pay you back for service. And so spending a year in an underserved area, sometimes you can get as much as $15,000 to $20,000 a year to pay back your student loans. For myself, I took advantage of what was called the Faculty Loan Payment Program. And at the time I graduated my specialty program, which is endodontics, I took on a role at the dental school as Director of Multicultural Affairs. And so for those first 4 years, I was enrolled, and a portion of my loans was paid back through the Faculty Loan Repayment Program, which is a branch of the Public Health Service at the time. And so there's a lot of creative ways. Again, another thing I would look for is scholarships. You'll be surprised how many scholarships are available that may fit many of the areas that are uniquely yours, such as if you're from a certain area, a certain rural area in the United States, if you're from a certain area, for example, that doesn't have a lot of dentists in it, for example. There may be loans from organizations, community organizations, that will pay you to go to dental school and can pay you back, but also many times they tie a service component with that and ask you for service in that local community. But again, I would just, again, be creative about the thought process. I will start to look around for scholarships. I will try to take out as few loans as I possibly can. So I would not take out loans to buy any fancy car or any fancy clothes or to take a fancy trip. I would use the loans I take out for school for actual education and be very frugal about that. I would talk to my parents right now about how to budget, how to maintain your budget. If you have a budget of $25 a week or $15 a week, or if you work and you make $15 or $20, I would try to manage that in a way to say, did I use it the way I intended? You'd be surprised the things you can do right now on money management, on balancing budgets, on on taking care of your own personal finances that you will apply to the same process when you get to loan indebtedness. So again, to not be too long about the process, I would just say for me personally, think about how you can minimize the amount of loans you take out. There was another part of the question was how long did it take me to pay back my loans? I did 4 years of undergrad, 4 years of dental school. I did a 2-year residency at Harlem Hospital in New York City. At that time, my loans were deferred for that period of time. I did a 3-year residency program in my specialty area of endodontics. And then upon graduating, it was about 5 years after coming out and working that my loans were paid off. And so I was very happy that day I paid them off. But again, it was also helped by the Faculty Loan Repayment Program. And you'd be surprised how many programs are available to help you manage loan indebtedness.
And is it possible for me to add in just a quick note?
Absolutely.
Being that we are talking to high school students, I would encourage you all to ask around at your schools and see if they have programs that allow you to earn your associate's degree while you're working on your high school diploma. Here in Virginia, that's called dual enrollment, and that's something that I had the opportunity to do when I was high school, which cut down on my undergraduate loans because I didn't have to take nearly as many classes. And that is at no cost to the student or to the parents. It's just like going to high school every day. You'll take a little bit more challenging classes. You'll be able to earn your associate's degree, which will directly help you save. So look into that.
Jocelyn, some great advice.
Thanks for adding that. Just remind me one more thing, if I can just cut in, Elizabeth, and state also, the things you can control also while you're in high school and even in college is not taking out credit card debt. Many students, and you'd be amazed how many students come to the process of graduate school with amounts of debt that they can't pay that has nothing to do, again, with their educational process. And sometimes it is, and sometimes that's necessary. But be careful on taking out credit card debts that you can't pay back, that you now are accruing interest on those monies. And many students who are doing that already in college find it very difficult when they get to dental school because they have all this debt that's not just educational. So again, those are those budget pieces. And as Jocelyn, to kind of piggyback on what Jocelyn was saying as well, think about ways that you can maybe work study through school. I mean, I worked throughout my undergraduate years, throughout my graduate school years, but working at whatever level you can do that and still do well in your coursework is another great way to minimize the amount of loans you take out, but also be careful of that hidden credit card debt. You can control those choices and work hard to do that.
Great. Thanks so much, Dr. Esther. TJ, this is a question for you. One of the audience members asked how they could join Xhosa. So is that something you could speak to a little bit, please?
Yeah, sure. I was a state officer the last year of my high school experience, so during my senior year, I was the vice president for Delaware Xhosa. A lot of times, I think majority of the states, almost all 50 states, and even a few other countries have Xhosa. So you could definitely reach out to a state officer. A lot of times, the websites for Xhosa you could just find by typing in your state and Xhosa after it. And just look into that if you could. There's usually contact emails or anything that you could find to reach out to someone. And if you don't have Xhosa at your school, starting one is very possible. And if it isn't, there still are other ways that you can get involved with health and many other things in the health-related fields. But Xhosa, if you can find a way to get into that, definitely try to contact someone. It's a really great experience.
Great. Thanks so much, TJ. So another question that came in was about how many schools you would recommend, dental schools you would recommend applying to. The person had heard 12. I'd be curious maybe to hear from Dr. Esther and Jocelyn. Jocelyn, maybe you can tell us a little bit about how many schools you actually applied to. And Dr. Esther, from your standpoint in the admissions and recruitment side, maybe you have a different opinion. How about we start with Jocelyn?
For me, it was recommended to apply to about 7 or 8 schools. I applied to 6, a nice even number, right? I do have classmates here that applied to as many as 14. It's really just something that you guys are going to have to kind of make a personal decision about. It's no right or wrong answer for that. Different factors are going to go in, such as how strongly you feel about your application packet, your DAT scores, where you're actually interested in going, as well as there is a financial element to that as well. So there is no wrong answer, in my opinion, to this question. Just start thinking about the schools you want to go to, places you want to go to, financially, which you feel like you'd be able to handle, as well as totally blanked on what my last point was there, but just financially and schools that you're interested in.
Sure. Thanks, Jocelyn. And how about you, Dr. Esther?
Definitely. The national average is around 10 schools. However, when I have a chance to talk to students like I am right now, I encourage them that it's not about quantity, but about quality. And the quality, you know something about the schools you're applying to, that they're actually places that you can see yourself spending 4 years. Most dental schools are 4 years. There are a couple of dental schools that are 3 years. But for the most part, dental school process is about a 4-year educational process. Is that a place I can see myself spending 4 years in? Am I going to be supported in this space, in this place? Do I have people outside in the community that can support me? Will I get the educational benefits that I'm looking for, such as if I have an interest in research, does the school have a strong research component or program? If I have an interest in service, do the students spend time out in community service? If I have an interest in going to a specialty program, does the school have that actual specialty program? There's so many varied reasons why a person would choose to apply to a school. But I think students need to be selective, and so I like quality more so than quantity. I think when you're really honest with yourself, 3 to 5 schools is probably all you probably really need to apply to. That's probably all you really want to go to, if you're really honest with yourself. And I would then encourage you, therefore, if you're going to limit the number to somewhere around less than 10 or 3 to 5, to think about what kind of connections have I made with that school. Have I attended any special programs at this school? Have I met any of the faculty, any of the admissions personnel? Have I met any of the researchers in the school? Do I have a connection on the campus? I would think about the quality of my application and how favorable I feel as though I will be able to be successful in the admissions process. But I always talk to students about picking 3 to 5. If you decide to find more than that, of course, that's fine, but just know that you have a value in the application process, and the more schools you select, the higher the cost will be for the application process. So that's just something to consider, and definitely I think somewhere around 3 to 5 is what I would suggest to students.
Great. Thank you so much, Dr. Esther. Another question that came in is really for Jocelyn or Dr. Esther. The question was, did either Jocelyn or Dr. Esther apply to a dual degree program where you can apply to undergrad with confirmed admission to dental school? If not, can you speak to how good of a decision that would be? That's kind of an interesting question. So maybe Jocelyn, we'll start with you. I'm not sure, where you applied. So did you apply to a dual program where you could apply as an undergrad with the confirmed admission to dental school?
I did not apply to a dual program, so I unfortunately would not have a lot to offer about that. But just with any other programs, find people that have been through the program that you're interested in and ask a lot of questions and do your research.
Yeah, great answer. Dr. Esther, any comments on that question?
For sure. That terminology, dual degree program, at the University of Michigan, that term usually implies that a person is applying to a double program, such as a DDS or PhD program combined, when we use the term dual degree program. What we can consider to be preferred admit programs are programs in which a student at an undergraduate level, and we don't have it currently at the University of Michigan, but there are several dental schools or campuses that do have this type of program. And the terminology or semantics may be different, but we refer to it as a preferred admit or early admit type program, where a student applies to the undergraduate school, but also applies to the dental school at some level, not in the formal process of the admissions process that we've been describing through ADIA and through ADSAS, but through a process where the professional school understands this person has an interest in attending. And then there's some criteria set around what a person needs to maintain to stay a part of this program as an undergraduate student. So, and usually there's a GPA component that you have to maintain a certain GPA. Many times you have to have a mentor in that professional school program. Many times you will have events throughout your 2 to 3 year process and applying and steps or standards you need to meet each year. Sometimes you will meet with faculty or a researcher or a missions person at the professional school, at the dental school. And then upon completing successfully the standards that are set for that program, then you apply to dental school through the usual process at the 3rd year, and you may get in and limit the number of years that you spend in undergrad. And typically, your degree for undergrad is conferred either with the dental degree upon graduating from dental school or after the 1st year when you completed enough requirements to satisfy an undergraduate admissions degree. So we consider that to be a preferred admit program. I did not personally apply to a program like that. When I did apply to Michigan, they did have a preferred admit program, but it was really for students off of the campus. And so a lot of times, again, if you're applying to, you're thinking about the undergraduate school you will attend, if that school has a dental school, then I think that's a great question to ask. And that may be another way in which you start to decide to this previous question, how many schools do I apply to? Well, I want a school that's going to give me a chance to limit the number of years I will spend in undergrad, and that may take so many schools off of your list. The other point I will offer on that topic is dental hygiene. It kind of goes back and refers to another question we described earlier. For those who have an interest in dental hygiene and see that as a process in their steps toward dental school, that's another great way to attain an associate's degree, or some programs have bachelor's degrees in hygiene, where you can use that as your prerequisites as you're applying to dental school, your preparation. Of course, you still need to complete all of the requirements for dental school, because you may not get those necessarily in a hygiene program. But it's a great benefit for students who come in with a dental hygiene background, who come into the dental profession with a dental hygiene background. They understand the educational component, they understand prevention, they have a skill set. They can work their way through dental school and do quite well in the process as far as decreasing the amount of loans. So I always like to throw that out there when I talk to students about strategies to decrease loans, think about dental hygiene as a pathway to dentistry, and there are some programs that will allow that.
Great. Thank you so much, Dr. Esther. Just a few more questions before we wrap up. One question about the infamous DAT. When's the best time to take the DAT, and how long should you prepare for it? I think I will give Jocelyn the floor on this question, since she is the one who most recently had to undergo this.
Yes, absolutely. Great question. From my experience, it's going to be most beneficial to you to take the DAT the summer of the application cycle that you're going to be starting. So let's say, for example, you want to apply to attend dental school in 2016, then you should have taken it this past summer. Me personally, I probably did not spend as much time as I would have liked preparing for the DAT. But I hear roughly about 6 weeks or so is where a lot of my classmates kind of fell with their preparation. But that was 6 weeks of about 8 hours a day. So if you are someone who cannot go to the library for 8 hours a day or study that length of time per day, you might want to consider doing maybe 6 hours a day for 2 months or something around that time. It's a very important test. There's a lot of different parts on it, and you cannot over-prepare for this test. And that's not to say that you should be stressing and that kind of thing, but you do want to take your time with it, give yourself an appropriate amount of time to prepare, understand the sections, understand how questions are going to be asked, so that you're giving yourself the best opportunity to succeed. So I would aim probably for about 6 weeks of studying and apply and finish the DAT within the same summer. So, for example, like I just said, if you want to apply for 2016, then this summer you would have been preparing for your DAT and applying for school.
Great. Thank you so much. Really appreciate that. Well, I think we have one more question for everyone, and I think that'll probably be a good place to end our session this evening. The question's for everyone, and it's, what do you believe is the most important skill required to be a successful dentist? That's probably something you may have mentioned when I was asking questions, but maybe we can reiterate it right here. TJ, why don't we start with you?
Other than all of the actual, skills and knowledge I need to have about the dental profession, I feel personal skills and communication skills are very important in order to know your patients, be able to, if a patient is scared of the dentist and has dental phobia, being able to just be the person that can get them to be calm and someone that they can talk to, someone that they are happy having as their doctor. I think that communication skills could really help with that. So work on those.
Great, thanks. What do you have to say about it, Dr. Esther?
I definitely hallmark and echo personal, interpersonal skills, people skills. But just to add to that, I would say even business skills, business acumen. If you think you want to practice and have your own dental practice or work as an associate in a practice or have some form of practice relationship, get some experience and understanding how businesses are run, what it requires, how to make decisions around that. And to make that a viable part of your educational process, whether it be in high school, whether it be in college. I think getting some business information into your educational process would be very useful.
Great, thanks so much. And Jocelyn?
I'm going to have to go with the same. Interpersonal skills cannot be understated in this profession. You're going to be interacting with your classmates. You're going to be interacting with your patients. You're going to be interacting with your professors. So being able to deal well and work well with people will be vital. It'll get you through the things that you struggle with. So do not underestimate that. And just to add on a little bit there, if the sooner you start working on your dexterity and hand skills, the better that will serve you in your future.
Great, thank you. Actually, I got one more last question that I think is and it's for you, Jocelyn. I think it'd be valuable to answer. It's a question for Jocelyn. Briefly describe your typical day as a D1 student at Virginia Commonwealth University. I think that's something everyone would like to hear about.
Yeah, I'm actually glad that you all asked. Me personally, I wake up very early in the morning, around 5 o'clock, and I go work out. I think it's going to be very important to you all in undergraduate and also in dental school to have ways to manage stress and anxiety. And for me, that involves the gym. So every morning I go to the gym. So for a couple hours, and then by 8 o'clock we start class, and you're pretty much in class from 8 to noon and then 1 o'clock to 5 o'clock. And so you have your lectures as well as your dental anatomy and operative dentistry labs. So pretty much 8 to 5 every day your schedule is set for you. So don't have any plans during 8 to 5 Monday through Friday. And then normally Friday evenings around 5 o'clock, I'll go get some food with my classmates, and then from 6 o'clock to probably about 9 or 10, you're in the library or you're studying. And so that's very demanding. Your weeks and your times of the day are pretty much set for you, but I cannot say that this is something that I would not want to do. This is very rewarding. It's hard, it's difficult, it's very time consuming, more than I probably even would have thought, but this has been the most fun that I've had in life, and that's hard to say. It would be hard to believe when you look at some of the schedules that we have to do, but it is very rewarding being here. So don't worry about the time management, you'll get it. Don't worry about it being challenging, you'll get it. Just have fun.
Great. Wow, I wanted to say thank you so much, my three wonderful, wonderful panelists, for being so honest and open and giving us some great information. I think audience members are walking away from this webinar with some great information. We got to most questions, but not everything. So if you feel you didn't get the answer you needed, please feel free to email us at godental@adia.org, and we'll be happy to answer your questions. Have a wonderful evening. Thank you again, panelists. You were wonderful. Thank you, audience members, for joining us, and we hope to see you again next time. Thank you so much.
Thank you. All right.
Bye.